Welcome to the Macmillan Report. I'm Marilyn Wilkes, your host, and our guest is Marcia Inhorn, the William K. Landman Professor of Anthropology and International Affairs. A specialist on Middle Eastern gender, religion, and health, Professor Inhorn has conducted research on the social impact of infertility and assisted reproductive technologies in Egypt, Lebanon, the United Arab Emirates, and Arab America over the past 30 years. She's the author of 5 books on the subject, as well as 9 edited volumes. Today, we'll talk with Professor Inhorn about her new book, Cosmopolitan Conceptions, IVF Sojourns in Global Dubai. Welcome, Professor Inhorn.
Thank you for inviting me.
It's so nice to have you back on the show again with us.
It's a pleasure.
So let's begin with an overview of your book. Tell us about it and its premise.
Yes, so infertility is a global reproductive health problem that probably affects as many as about 15% of the world's population of reproductive age, people who have trouble having a child. And for many of those cases of infertility, the only recourse in terms of overcoming it in order to have a child is to try in vitro fertilization, an assisted reproductive technology. But in many countries, there is no in vitro fertilization, or it's very expensive, or it's legally restricted in some way, or it's simply just not available. And because of that, there are thousands, perhaps even millions of infertile men, women, and couples traveling the world trying to access in vitro fertilization, which I'll just call IVF from this point on, trying to get it in places where they can safely, affordably access it.
Okay. And how did you come to be interested in this topic?
Yeah, I've been a scholar of infertility for really my entire life. My career, I'm a medical anthropologist, and I have always been interested in social suffering, stigma, what makes people, kind of miserable. And in the reproductive world, if you want to have children and you can't do it, your body doesn't cooperate, it's a really profound heartache, for people. It's a source of real profound suffering. And so I started, looking at infertility in Egypt in the late 1980s, and it was just at the beginning of in vitro fertilization, IVF. Making a test tube baby had just become possible in the UK, and I really started following the spread of IVF into the Muslim Middle East. I'm a scholar of the Middle East. And so I've been really studying the impact of IVF in places like Egypt, Lebanon, and the United Arab Emirates, which is the topic of my most recent book.
Okay, so I would imagine that it is a painful topic for many people. I'm curious to know how you did the research for the book.
Yes, so for this particular book called Cosmopolitan Conceptions, IVF Sojourns in Global Dubai, I was interested in Dubai, one of the 7 United Arab Emirates, and it's really a global city now with about 2 million people in it. And it's become a kind of hub, what I'm calling a repro hub, or a medical tourism hub, for people coming from really about a third of the world's nations, flying into Dubai to try to access medical care, and in this case, IVF. And so I ended up situating myself in what I call a kind of cosmopolitan clinic, a clinic called Conceive, in the emirate in Dubai, actually on the border of Dubai and the neighboring emirate of Sharjah. And it was a clinic that had really developed a kind of global reputation as a safe, affordable, effective place to go seek IVF. And so I literally, in staying in this clinic for about half a year, I literally interviewed about 220 people I call reprotravelers coming from 50 different countries around the world seeking IVF.
Okay, and they had no problem speaking with you?
No, for the most part, because they had been through a very sort of tortuous journeys to get there. They had, often it was a place of last resort. They had spent a lot of money. They had struggled so much to get to this point. Usually they wanted to speak to me about their sort of travails, their journeys, their sojourns, why they had come to this particular clinic. And so no, I ended up really, talking to men, women, and couples together from really all over the world. I would say every part of the world was represented except for Latin America and the Caribbean, because that's very far away from Dubai. But there were people coming from Europe, from the UK, from the US, Australia, many people coming from other Middle Eastern countries, and many people coming from parts of Asia, South Asia, India, Pakistan, Sri Lanka, Malaysia, Indonesia. So it's really,
Wow.
you know, it was a site of global, these kind of cosmopolitan conceptions as I came to think of it.
I am wondering why Dubai, of all places. Is it so much cheaper? I mean, when you mentioned people from the United States and the UK and Europe going, that's surprising to me. So
Yeah.
why do you think Dubai is emerging as this medical repro hub?
Yeah, part of it is statecraft. Part of it is Dubai trying to become a place of medical care, a kind of global medical tourism site. I mean, Dubai specializes in international tourism. It's a global tourism and shopping hub. But they have actually developed something called Dubai Healthcare City, which we would call a medi-city, a kind of small tax-free zone where they have, you know, hundreds of medical professionals and clinics, and people can travel there. The clinic I was working in was not located in Dubai Healthcare City, but the point is that Dubai is trying to develop this sort of global medical tourism reputation, and because of that, people think of Dubai, particularly in certain parts of the world, as the kind of go-to place to get a sort of higher quality of medical care than they can access in their home countries. And so, for example, there were many people coming from the eastern coasts of Africa, sub-Saharan Africa, people coming from Somalia, Djibouti, Tanzania, where there are no IVF clinics. And so for them, it's sort of proximity and this kind of reputation of being a place where you could safely access health care. For people coming from the West, and there were many people in my study coming from the West, it's not that it was less expensive. In fact, Dubai actually offers rather expensive IVF. It costs about $5,000 to $6,000 US dollars to do a cycle of IVF in the UAE, but that is less than half of the price of a cycle of IVF in the United States.
Wow.
The US is the most expensive place in the world to do IVF. The average here is about $12,000 US dollars, and most people don't have health insurance to cover it. IVF is not considered to be something that is considered to be a kind of elective procedure rather than a medical necessity.
Right.
And so in the US it's not covered, and so people really have to spend a lot of money to try to access it in this country. So yes, some people from the US will actually travel to other countries to try to access less costly, more affordable IVF care.
Okay. In the prologue of your book, you write about Rania. Why did you choose to write about her, and tell us a little bit about her reproductive journey?
Yeah, so I decided to focus on this story, a very poignant story and a very kind of capacious, very fully detailed story of a woman who I call Rania. It's not her real name. She was an Ethiopian Eritrean refugee to the UK. She had left as a teen to escape, political violence, and was a refugee and now a citizen of the United Kingdom. And she had met another refugee, a Sudanese refugee, and they had married. And they had a very tumultuous path. They had trouble getting pregnant. She had tried 8 IVF cycles in the UK. Wow. I mean, under the National Health Service in the UK actually will subsidize cycles for people. And so she'd tried, subsidized IVF in the UK, which hadn't worked. She'd gone to the private IVF sector in the UK. And through all of that, she had ended up with 1 daughter. And being an African woman, in her community in the UK, she lived in a kind of African community in the UK, she was stigmatized as being a woman really without children. She had 1 daughter, but in her society, people had 4 or 5 children. And she desperately wanted to have at least 1 more child to be a sibling to her daughter.
Sure.
And so, through a variety of circumstances, she ended up coming to this clinic called Conceive. She came to Dubai hoping to try to get access to IVF that she could afford and would be safe. And she had a very difficult time. She, unbeknownst to her, had a reproductive tract infection that was sort of inside her body. And when she came to the UAE to do a 9th IVF cycle, it sort of released this hidden infection. And she became septic. She had sort of a full infection that was life-threatening. They were able to treat it, cure it, and sent her back to the UK and said, you need to have parts of your reproductive body actually removed because they're infected and they're hurting you more than helping you. And still wanting to have a child, she came back to Dubai. She came back to the UAE, and she was successful. She did 2 more tries of IVF there, and she ended up having 2 more children, a daughter and a son. The last part of her story, which I sort of highlight in the end of the book, she tried 1 more time in the UAE when she was about 43 years of age. It was her 13th IVF cycle it didn't work, and so she didn't get, another child. But she ended up having three IVF children through incredible determination, thousands of, dollars spent to sort of have a normative life as a mother of children.
Okay, so let's talk about the main reasons people travel to places like Dubai for IVF.
Yeah, there's sort of four main reasons why people travel, and I'll just sort of go through them briefly. One is what we might call resource constraints, and that is that, frankly, in sub-Saharan Africa, for example, of the 55 countries, only 15 countries even have an IVF clinic. So there are many places of absence where there is no IVF, and people literally have to leave the country in order to access it. And then there are these cost considerations, people wanting to go for more affordable IVF care. And I would say cost is a huge issue driving people looking for less expensive places to go for IVF. Another huge area of consideration is legal issues, legal constraints, especially in Western Europe. Western European countries often provide IVF on the state sort of subsidizes it, but there are often legal reasons why you can't access it, especially if you're single, if you're in a gay relationship, or if you're over 40, or for men who are infertile, there are particular reasons why it's legally prohibited to certain categories of male infertility. And so there are many people in Europe who are traveling across borders trying to get legal access to IVF. And when they can't, we call them law evaders, or I call them reproductive outlaws. They're literally trying to evade laws by traveling to other countries to access IVF that's legal in other places.
Let me ask you this. If they are successful in getting pregnant through IVF and they go back to where they have come from, is there any ramifications?
Usually not, because they become pregnant and nobody can ask how they did it. They just come back. There's only one country in the world that has tried to prevent people from actually going out and coming back, and that's Turkey, which is an interesting case in and of itself. But yeah, so no, they evade the law by leaving the country, trying to get pregnant, and they come back. And then there are sort of what we might call quality and safety issues. People not trusting their home country health care. For example, you need hormones in order to stimulate a woman's reproductive cycle to get the IVF going. And in some countries, there are fake medicines. People in Nigeria, for example, are very concerned that it's not really, going to be efficacious if they do it in their home country. And they're concerned about safety, not just in Nigeria, but in many parts of the world where they feel that the quality of medical care is simply not good in their home country. And so safety and efficacy and sort of quality and doing it in a place where you feel comfortable, that it's safe and effective, is very important. And then there are a whole host of what we might call sort of socio-cultural issues, people concerned about medical privacy, people actually concerned if they do IVF in their home country that people are going to talk about them, that it won't be confidential. They don't want to be seen by people that they might run into in an IVF clinic, and so they will move. And sometimes people move just to have sort of linguistic and cultural connection with providers. And so there are sort of cultural, subtle nuances of cultural considerations. And so these are sort of four categories of why people are traveling, and together it's a lot of reasons actually why people would seek IVF outside of their home country.
Right. So it seems like it will just keep growing and growing for Dubai.
Yeah, and around the world they're showing that people are traveling to parts of Latin America, people are really traveling. There are now really thousands, perhaps millions of reprotravelers. There really isn't a good study, but the few studies that have been done have shown that thousands of people are traveling, trying to access IVF in other parts of the world.
Wow. Very interesting. Thank you for being here with us today and sharing your work.
Thank you so much for speaking with me about my book.
Okay, and good luck with it.
Thank you so much, Marilyn.
For more information about Professor Inhorn and her research, please visit our website at macmillanreport.yale.edu. Be sure to join us again for another episode of the Macmillan Report, made possible through funding from the Whitney and Betty Macmillan Center for International and Area Studies at Yale.